Thank you very much for joining the class. Last lecture, we looked at managing quality and service delivery. First lecture by covering learning at 1. Understand, identify, and meet stakeholder needs in the service delivery. And we captured the key service stakeholders as service users who are patients, staff, families, and professionals. And I asked you to go on to try and see if you will be able to answer task 1.1, 1.2, and 1.3. And today I intended to explain key terminologies and quality in terms of the healthcare sector. So we wouldn't look at the theories today as promised. So we'll go on and look at outcome LO3. Alright. So we start by looking at what we understand by quality of care, which is learning outcome LO3. Having understood the stakeholders involved in terms of quality, we like to look at LO3. When we say quality and service delivery, especially in the healthcare sector, it's all about carrying out interventions correctly according to pre-established standards and procedures, with an aim of satisfying the customers of the health system and maximizing results without generating health risks or unnecessary costs. Right. When we talk about healthcare, as I said in the last lecture, to maintain quality is quite difficult. It isn't like a manufacturing sector where you can afford to make a mistake. In terms of the healthcare sector, you can't just make a mistake. Things must be right the first time. So carrying out intervention correctly according to pre-established standards and procedures with the aim of satisfying customers of the health system and maximizing results without generating any risk or unnecessary cost. Sometimes making a mistake in the healthcare sector is very costly. First, it might cost the life of the patient or the service user. At the same time, it might cost organization involved in terms of legal issues, leading to a lot of financial losses to the organization. Alright, so when we say quality in terms of the healthcare system, it's a way that we need to carry out interventions correctly according to pre-established standards and procedures. Good. Next slide, the Oxford Dictionary define quality as the degree or grade of excellence. So when we relate this to health and social care sector, we need to provide excellent services, that is quality, to our service users, to our staff, to families, and then to the clinicians themselves. But the core to this quality concept in the healthcare delivery system has to do with patients. So, Agency for Healthcare Research and Quality define quality as the degree to which healthcare services for individuals and the population increase the likelihood of desired health outcomes and are consistent with current professional knowledge. When we say desired health outcome, it simply means being able to meet the needs of service users. For instance, if somebody is going to be operated upon, maybe to remove a tumor, the desired outcome is to be able to have a successful operation. So all attempts should be made to ensure that policies and procedures are followed to the letter, so as to make sure that the patient comes out of the operation without any health problem, and that the patient will be satisfied with the services that they receive. And again, as I said, in the healthcare sector, we are dealing with human beings, so quality is the key, as we can't afford a second chance. Right, let's look at the next slide. The National Association of Quality Assurance Professionals describes quality as the level of excellence produced and documented in the process of patient care, based on the best knowledge available and achievable at a particular facility. Facility being a care home is a facility, a GP surgery is a facility, a hospital is also a facility. So what do we want here is the level of excellence reduced and documented in the process of patient care. So again, patient is at the core. They are the main recipients of the services that we provide as health and social care professionals. And whatever we do in terms of quality, it must be based upon the best knowledge available. It should be evidence-based, so as to be able to help us to achieve excellence. The Community Health Accreditation Program also defines quality as the degree to which consumers progress towards the desired outcome. Again, the consumers here are service users or patients. Let's look at the next slide. Let's look at the dimensions of quality. When we say quality, what are the dimensions of quality? The dimensions of quality. The dimensions of quality. Number one, we have technical competence. Technical competence. Technical competence. Number two, access to services. Number three, effectiveness. Number four, efficiency. Number five, amenities. Six, interpersonal relationship. Continuity. Seven, and safety. And so, quality has got different dimensions that we can measure. So a quality system has got different dimensions. So if we want to look at effectiveness, it means that we have provided services to a patient in quite an effective way. That would be quality. The same way, in terms of efficiency, if we have efficient professionals who are working and providing the best possible outcome, that is also quality. And then we can also have quality amenities that will help health professionals to give out their best. We've also got quality in terms of interpersonal relationship, where there could be proper quality communication between patients, professionals, patients, and family members and carers. And then it will also have quality in terms of interprofessional multidisciplinary teams. When we have quality teams coming together, we are able to also make sure that we have the best possible patient outcome. Then we have quality in terms of continuity. The continuous improvement always bringing quality. And then we can also measure quality in terms of safety, so that we'll be able to provide our services in a safe environment. Quality can also be technical competence, skills that consultants have got. That is their technical expertise. They can give out their best. So quality can be looked at from different dimensions, from different points of. So when we talk of quality, it's different perspective, different perspective, different perspective. So that is quality. That is quality. That is quality. Let's look at the next slide. The next slide in healthcare domain, as I've described up in the first and the last slide, quality can be achieved in terms of effectiveness, efficiency, equity, patient-centered care, safety, and timeliness. So when we talk about effectiveness, that relates to providing care process and achieving outcomes as supported by scientific evidence. That is evidence-based. That is quality. Efficiency also relates to maximizing the quality of comparable unit of healthcare delivery or unit of health benefits achieved for a given unit of healthcare resource use. So here you can compare quality in terms of efficiency between two hospitals and find out how efficient each is. You can have quality in terms of equity of services, equity, so that people will have equal chances of better treatment. That is equity. You can also have patient-centered care. You can bring in quality in terms of patient-centered care, where individual patients are not seen as numbers, but are seen as individuals who are distinct, so that they'll be able to provide the best service that is tailored to suit that very patient. Again, as we explained before, we've got quality where we'll be able to work as health and social care professionals by operating in a very safe and secure environment. Timeliness is another quality domain. It relates to obtaining needed care while maximizing delays. For instance, if you go to the accident and emergency, which is supposed to be an emergency, and you spend 4 and 5 hours there, is that quality? So timeliness is quite important. If it is indeed accident and emergency, then cases must be dealt with swiftly and promptly as soon as you get there. Because it's an accident emergency, you have to receive urgent care. So all this relates to the issue of quality. This slide gives a bit of explanation of what I've just said. So effectiveness relates to providing care process and achieving outcomes as supported by scientific evidence. Efficiency relates to maximizing the quality of comparable unit of healthcare delivery or unit of health benefits achieved for a given unit of healthcare resources used. Equity relates to providing healthcare of equal quality to those who may differ in personal characteristics other than their clinical condition or preferences for care. Patient-centeredness relates to meeting patient needs and preferences and providing education and support. Safety relates to actual or potential bodily harm. Therefore, here we are trying to look at being able to provide services in a safe and secure environment. The timeliness relates to obtaining needed care while maximizing delay. And I've already explained that if an accident and emergency is supposed to be quick, then if you spend 4 or 5 hours waiting at the accident and emergency, that is not quality and needs to be improved. The next slide, we look at approaches of quality. Approaches of quality. We have the QC, which is the quality control. We have TQM, Total Quality Management. We have Quality Assurance, QA. We have CQI, Continuous Quality Improvement. These are all different approaches to quality. They are all different approaches to quality. Let's look at the next slide. Quality control. Quality control in healthcare organizations refers to activities that evaluate, monitor, or regulate services rendered to consumers. Right. It's quality control in healthcare organizations refers to activities that evaluate, monitor, or regulate services rendered to consumers. And we have observe, identify, and track as the key components of quality control. Observe, identify, and track. What do you observe? You observe the process. Identify the variable characteristics and track variables through statistical methods. So quality control is just observing the process, identifying variable characteristics, and track variables through statistical methods. So you'll be able to obtain what? The quality. You'll be able to control quality. So if you look at a tracking bit, you can track maybe incidence of death in childbirth. You can get the statistics and see if things are going wrong or right. So statistically, we could be able to quality control the process of health and social care delivery. So if things are not going right, then we can correct it. The next slide is about the quality control process. This is an 8-step process of monitoring and evaluating performance. It must include the following steps. Number 1, establish the control criteria. Number 2, identify the information relevant to the criteria. Number 3, determine ways to collect the information. Then collect and analyze the information. Compare collected information with the established criteria. Then out of that, we'll be able to make a judgment about the quality. Provide information and, if necessary, take corrective actions regarding findings to appropriate source. And lastly, determine when there is a need for re-evaluation. This, in a nutshell, is what is called quality control process. Now, total quality management, QQM, is one of the popular quality control approaches. Total quality management. Total quality management. TQM. Total quality management. It's a way to continuously improve performance at every level of operation in every functional area of an organization using all available human and capital resources. It's a way of continuously improve performance at every level of operation. So if we take the health and social care sector, let's say the hospital, the performance at every level could be, number 1, right from the receptionist, making the phone call, making appointments, speaking to customers, answering phone calls, and then passing on patients to the triage team, and then making sure that they'll be able to see the consultant for their treatment. If it's a care home, all the functional areas in the care home will be making sure there is quality in the meals that residents take. Apart from that, could be also quality in their medication, quality in where they sleep, quality in terms of dressing up residents. These are all continuous process in different functional areas. So if we talk of quality in the care home and you are able to give them proper medication on time and their diet is bad, that is not total quality. I can say it's a partial quality. So when we say total quality, it means that every functional area that the service user is being provided service must be managed and improved continuously so that the entire system is quality. Now the aim of this is to reduce waste and cost of poor quality. If we are able to continuously improve performance at every functional area, we'll be able to identify mistakes early and therefore be able to reduce any waste, because you don't have to wait until the end of the production line before you detect that something is wrong. Right from the beginning, everything must be monitored. So in the health and social care sector, every aspect of service usage must be monitored so that there wouldn't be any mistake. Right from making appointments, reducing delays, making sure that patients are received warmly, making sure they receive the best consultation, making sure they receive the best prescription, making sure that their ailments or sickness is dealt with promptly and appropriately so that they will enjoy very good patient outcome. That is total quality. The main elements of total quality management are three. The customer, whose needs are found in the determination of quality. And in this case, the health and social care, our customers are patients. The customers for health and social care are patients. So we want to make sure that the needs of patients are paramount if we want to say that we are using total quality management. Number two, the teamwork as a means of achieving quality. To be able to achieve quality, there should be teamwork. In fact, teamwork is so key in the health and social care sector. So without teamwork, there can't be any quality. Probably we might have quality in certain areas because we have different skills. But total quality will always elude us if we don't work in a team. So teamwork is one of the main elements of total quality. For instance, the teamwork between day staff and night staff for a care home would be that they will communicate with each other, do proper handovers of their shift duties, explain what has happened in the daytime so that the night staff can take over effectively, knowing what they need to do and whatever has happened during the day. That is teamwork. Another element of TQM is the scientific approach to decision making based on data collection and analysis. That's a wonderful one. Whatever decision that is taken is based on data collection and analysis. Using scientific approach, this makes total quality one of the main approaches in maintaining quality for service delivery, especially in the health and social care sector. So let's look at the next slide. The next slide is quality assurance. What do you understand by quality assurance? You'll be hearing the term all the time. And how does it apply in health and social care? All of the activities that make it possible to define standards, measure, and improve the performance of services and health provided so that care is as effective as possible. That is quality assurance. In health and social care, there are a lot of bodies that come in to ensure that possible defined standards are met. And one of the main agencies is the Care Quality Commission, which is they will make sure that quality assurance in the care home is maintained. They will make sure that quality assurance in any health and social care sector is maintained. The next slide, quality assurance defined as a process for objectively and systematically monitoring and evaluating the quality and appropriateness of patient care, and pursuing opportunities to improve patient care for resolving identified problems. Again, this is where the CQC comes in, to make sure there is objectivity and to systematically monitor and evaluate the quality and appropriateness of patient care. Quality assurance will also be the focus of quality assurance is the discovery and correction of errors. These activities are carried out by quality assurance personnel or department personnel. The next slide, we look at quality assurance again. Define quality assurance standards, norms, guidelines. One cannot measure that which one has not defined. One cannot measure that which one has not defined. Standards, norms, and guidelines. Measure quality, evaluation in standards. Again, one cannot improve that which one has not measured. Improve quality is just simply complying with norms. Let's look at the next slide. Continuous quality improvement. CQI is a cyclical process. Because as the name implies, it's continuous. It involves identifying an area where there is an opportunity for improvement and outline the sequence of activities that should occur in order to solve that problem and implement it. Once the cycle is completed, it has to be determined whether the problem has been solved. If the problem continues, the cycle should be repeated. So CQI is the cyclical process. Good. The next slide, we look at opportunity for improvement. Look at the actual. From 0% to the desired standard you want to achieve, 100%. So the difference between the actual and the desired state is the opportunity for improvement, as shown by the black arrow. So the difference between the actual and the desired standard is the difference between the actual and the desired state. That is the opportunity. So wherever there is a difference between the desired standard that we are supposed to maintain as a health and social care professional and the actual standard that we are able to meet, then there is a gap that we need to provide and need to bridge the gap and bring what? Improvement. So standard of performance will be defined for measurement using indicators. Let's go to the next slide. Model quality improvement. What are we trying to accomplish? How will we know that a change is an improvement? What change can we that will result in problem. Let me go over again. Model for quality improvement. Let's ask yourself, what are we trying to accomplish? Number two, how will we know that a change is an improvement? What changes can we make that will result in improvement? So if you look at the arrow, you can plan, not just plan, do whatever is planned, study your plan, and act your plan. In that slide, we look at your quality improvement cycle. There are 7 steps involved in implementing continuous quality improvement cycle. Number 1, identify an area where opportunity for improvement is. So, for instance, in a hospital, you can identify that delays in A&E accident emergency is something that we need, something that we can improve. That's an opportunity. Step 2, define a problem within that area. So, as I've said, the main problems are delays of patients. And apply a sequence of activities, the process that should occur in that problem area. What should occur to make sure that the place can be run smoothly without delay. Number 3, outcome of the process needed to achieve it. So if there are actual waiting time at AE, what is the desired outcome? What is the requirement needed to be able to achieve it? In this slide, select specific steps in the process. And for each step, list the factors that prevent the achievement of the desired outcome. Steps in the process. And for each step, list the factors that prevent the achievement of the desired outcome. So in the case of our example in the A&E, what would be some of the factors that prevent the achievement of the desired outcome? You can list example as a patient coming in with injury at the weekend because of excessive drinking. That could be a factor. While many people are coming in at A&E instead of going to their GP. Number 5, collect and analyze data about the factors that are preventing the achievement of the desired outcome of the desired steps. So in case we find out that people get drunk on Friday night, and Saturday night, and people at the hospital, what can we do? Because we can collect data on that and see that every weekend, many people are coming with a lot of injuries as a result of maybe falling down or vomiting because of excessive alcohol. So we can collect all this data and understand them and try and take corrective action to improve the process. And 7, we try and monitor the results of the action taken. So it could be seen that the corrective action is being to make sure that the pubs will not serve excessive drinks to vulnerable customers. Again, the pubs will be closed early. So these are all corrective measures that will be taken which are outside the hospital. Or within the hospital, actions will be taken in the form of getting more consultants, getting more nurses, so as to speed up consultation. And then we need to monitor the result of the action that we are taking. So if we are employing more consultants and more nurses, then we have to monitor the actions that we are taking. So we look at key quality assurance theories, and I will leave you here and make sure you read through it and understand it so that it will be able to help you to answer the assignment. If you have any question, please drop it an email and let me take it from there. I'll meet you on Friday. So if you have any question, get prepared with questions. So when we come over, then I'll be able to ask. You can ask, and I'll be able to answer. Please do not wait until we finish all the learning outcomes before you start your assignment. You can start your assignment now. And if you have any difficulty, please don't hesitate to call me. Thank you very much. Thank you for your time. Bye.